So moving forward to the nurse of the week, and oh my, Olivia, you got this one. You nurse of the goddamn year. I absolutely love. So this is a video of Olivia, a nurse that was singing to a terminally ill patient, her favorite song, and it just took my heart away. It's a beautiful thing. You watch it, and then we'll do the background right after.
Oh, I hope you're dancing in the sky, and I hope you're singing in the angel's choir.
Oh my God. Oh, that's just beautiful. Just beautiful. I mean, there's nothing more than just beautiful. I love that. So the patient in the bed, Margaret Smith, really sad story. She's only 63 years old. After she got diagnosed with cancer, they wanted to do a transplant on her, but they found her to be way too sick and that she would not survive a transplant surgery. So she's just terminal right now, and she's on her way to go. And what this nurse decided to do on such a sad and horrific, mind you, she's 63, right? 63 is the new 50. She's young, you know. People at 63 are still working full-time jobs, taking care of family members, kids. At 63, your parents are still alive, right? This is not, 63 ain't old. It's just not anymore. It's just not. So her daughter, Megan, recorded this whole thing happening, Nurse Olivia singing to her mom, and put it on Facebook, and this video just blew the hell up. I mean, the video has more than 2.8 million views currently. It's been shared over 55,000 times, has more than 40,000 likes. And when Megan, the daughter, was asked about the situation, she said, "This nurse sat with my mom for hours while the medicine from 2 months anesthesia, and sang a very special song to my sweet mother to comfort her. You never left her side by choice," the post read. "Your words cannot describe the appreciation and love we feel for Nurse Olivia, who Mom calls her angel." Oh, that's just the sweetest thing ever. "Your dedication to your patients is beyond any that I have ever seen. You're truly a beam of light, and I cannot thank you enough for the compassion and care that you've shared with my mother." And I mean, when it comes to caring, when it comes to, I mean, like, this is bedside manner at its goddamn best, right? It just doesn't get any better than this, right? Mind you, if you can't sing, don't go ahead singing for patients. It might do the opposite effect, and you know, if you can't sing, you can't. Not every nurse can sing, and that's not what our jobs is. Our jobs is to care for the patient the best way we know how. So if a patient has a favorite song and you play it for them, bing, bang, boom, you already goddamn winning, right? You're already winning. If a patient just wants a picture or likes to draw and is a terminal, it doesn't matter how you do it. If you take that extra step, if you take that step where it's not literally on your task list, where you have to give them this med, or you have to help them change their brief, or you have to, you know, change your wound dressing, or do a, you know, whatever the task is, IVs, who gives a shit? Whatever the task is, if you take that extra step into making them feel a little bit comfortable in the situation that no one wants to be sick, no one wants to be ill, no one wants to be terminal, no one wants to lose a family member. If you take that extra step and just make them a little more comfortable, feel a little more comfortable about the situation, talk them through the situation, that is what nursing's about. Fuck the skills, fuck the meds. All of that stuff is knowledge. All of that stuff you need to know. All of that stuff is insanely important, because the caring doesn't work if you are doing all of that stuff wrong. But once you're done with that stuff, that's where the nursing actually happens. Because all of that stuff can be done. That stuff is just walk through. You can have a robot do all of that stuff. But you can't care. Compassion is what we do, is what we are as nurses. So, Olivia, Nurse of the Week, congratulations. It's a beautiful, wonderful, wonderful job. I think that it just doesn't get any better. It just doesn't.